Today is March 21st, World Down Syndrome Day. It's a very special day for me, and I'm thrilled to share this experience with you. Creating this video about Down syndrome has not only taught me a lot, but also deeply moved me. Taking this step towards raising awareness with you is truly an honor. It's a fact that Down syndrome is often misunderstood in our society with many unknown truths. However, through this video, our aim was to reach more people and raise awareness. I hope this video has provided you with insight into Down syndrome and contributed to creating a more understanding society on this matter. But this journey doesn't end here. I invite you to follow my channel and turn on notifications so you don't miss our other videos addressing important topics like this. Together, we can make a bigger difference. Remember, we are all different, and it's these differences that bring beauty to our unity. Together, we can build a more understanding, inclusive world. Following the United Nations Declaration of March 21st as World Down Syndrome Day, various awareness events are organized worldwide. Down syndrome is a chromosomal anomaly. While a typical human body has 46 chromosomes, individuals with Down syndrome have 47 chromosomes. It occurs due to an extra chromosome in the 21st pair during cell division, hence it's also known as trisomy 21. There are no geographical, national, or socio-economic boundaries for the occurrence of Down syndrome. The only known factor that causes Down syndrome is maternal age, with the risk increasing as the maternal age advances. In our country, pregnant women are informed about screening tests and ultrasound examinations for fetal anomalies and chromosomal disorders like Down syndrome, and necessary guidance is provided. It occurs in approximately 1 out of every 800 births. There are around 6 million individuals with Down syndrome worldwide. There are 3 types of Down syndrome: trisomy 21, translocation, and mosaic. The diagnosis of Down syndrome is usually made shortly after birth or in the early postnatal period. Some physical features commonly seen in individuals with Down syndrome include slanted small eyes, flat nose, short fingers, curved little finger, thick nape, a single crease in the palm, and the big toe being more separated from the other toes. Individuals with Down syndrome are more prone to certain health conditions. Therefore, it's important to ensure regular and timely health checkups. The physical and intellectual development of babies with Down syndrome is typically delayed compared to their peers. However, with appropriate educational programs, they can successfully integrate into society. What is Down syndrome? Down syndrome, also known as Mongolism or trisomy 21, is a genetic anomaly characterized by the presence of 3 copies of the 21st chromosome instead of 2, resulting in specific physical features such as short stature and almond-shaped upward slanting eyes. People with Down syndrome, a chromosomal disorder, have 1 extra chromosome and are born with 47 chromosomes instead of the typical 46. In addition to physical appearance, the developmental process of the brain is directly affected. Due to having 1 extra chromosome, Down syndrome manifests itself clearly, especially in terms of physical appearance. Among the characteristic features of Down syndrome are slanted eyes, widely spaced eyes, and a flat bridge of the nose. Down syndrome has 3 different types: trisomy 21, translocation Down syndrome, and mosaic Down syndrome, with a higher prevalence among women in the older age group at risk of having children. This age group is generally considered to be 35 years and older, but children born to women over 35 may not necessarily have Down syndrome. Down syndrome, for which there is no absolute cure, includes various therapy methods to help individuals reflect their full potential and adapt to life. Why does Down syndrome occur? Down syndrome occurs as a result of an abnormal cell growth where individuals with Down syndrome have an extra copy of the 21st chromosome, whereas typically there should be 23 pairs of chromosomes in each cell of a normal human. In short, having 47 chromosomes instead of 46 chromosomes in individuals leads to the occurrence of Down syndrome. This condition negatively affects the developmental processes of the child. Both physically and mentally, children with Down syndrome lag behind normal individuals and their peers, and efforts are made to integrate them into the normal flow of life through therapy methods. Down syndrome, which does not have another exact medical reason, is associated with having children in risky age groups. The risk of giving birth to children with Down syndrome is higher for women aged 35 and older, but this does not guarantee the occurrence of Down syndrome. What are the types of Down syndrome? Down syndrome is divided into 3 types: trisomy 21, translocation Down syndrome, and mosaic Down syndrome. The most common type of Down syndrome is trisomy 21. Trisomy 21, approximately 95% of individuals with Down syndrome have classical trisomy 21. In this type, individuals with Down syndrome have 3 copies of chromosome 21 instead of the usual 2 copies in every cell of the body. Translocation Down syndrome. This group constitutes a small percentage of individuals with Down syndrome, about 3%. In translocation Down syndrome, part or all of chromosome 21 is observed to be attached to another chromosome rather than being a separate 21st chromosome. Mosaic Down syndrome. This group affects about 2% of individuals with Down syndrome. Mosaic means a mixture or combination. Children with mosaic Down syndrome have 3 copies of chromosome 21 in some of their cells. However, other cells have the typical 2 copies of chromosome 21. Children with mosaic Down syndrome may have the same characteristics as other children with Down syndrome. However, due to the presence of cells with the normal number of chromosomes, the symptoms may be milder. What are the symptoms of Down syndrome? The most distinctive symptom of Down syndrome is slanted eyes. Additionally, among the symptoms of Down syndrome are a flat bridge of the nose, small hands, feet, and ears, short stature, a crease in the palm, and an abnormally large tongue. Other symptoms seen in children with Down syndrome include slanted eyes, flat bridge of the nose, small hands, feet, and ears, small head, short stature, crease in the palm, palmar crease, abnormally large tongue, white spots in the colored part of the eye, iris, brush-field spots, excessive flexibility, short stature, difficulty walking, moving, and speaking, vision problems, ear infections, dental problems. Additionally, some babies may have skin symptoms such as paleness or blueness. These can develop due to other problems accompanying Down syndrome. These problems include conditions ranging from congenital heart disease and polycythemia, excessive production of blood, to blood disorders such as leukemia. Furthermore, babies may experience feeding and eating problems due to muscle weakness, bowel problems, and intense and prolonged jaundice problems in the newborn period. In later ages, more intellectual retardation, language, speech, and cognitive skills deficits are observed. The degree of these deficits and difficulties can vary in each child with Down syndrome. Is there a treatment for Down syndrome? There is no treatment for Down syndrome. However, it is possible to help the individual and their family with sociocultural support and appropriate education programs. Special education programs begin when the baby is 2 months old. The aim is to develop and improve the baby's sensory, social, motor, language, and cognitive skills. Especially if you're over 35 and planning pregnancy, it is recommended that you undergo the necessary screening tests and consult a gynecologist. Thank you for your support, and I look forward to seeing you in the next video on my channel.